ever feel like medicine gets a lot wrong about your health? Are you a woman? So do you really think medicine gets a lot wrong about your health? The answer is yes, it does. And we're going to talk about some of that today. Let me start with, I am not a doctor. What I am is a very experienced patient. I have been through so many medical treatments. I have done a ton of research, which I will share with you. I know you can do your own, but I want to give you some insights about what you might be experiencing in the medical system and why. So, are you ready? The first one is this. Do you know that most medical research historically has been done on men? Really good reasons for that. Because we're women, we make babies. That's why research has been done on men. But when you think about it, that means men are considered the norm. Men are normal. The experience of men is normal. So if you happen not to be a man, which I happen not to be, and maybe you happen not to be, then you're not normal. So from the beginning, starting with medical school, starting with the history of medicine, women are a little bit at a disadvantage because we are different from men and there is less known about how we work. That's not putting blame on anybody. I don't want all of y'all to go shout at Candace Owens and say, here's another rabid white feminist. I'm just talking facts to you. That there's less research done on us, there will be more. That's one reason why care is different for us than it is for men. What are some things that happen to women that don't happen to men? Cramps, pretty much a woman thing. Endometriosis, also a woman thing. And by the way, a lot of women who have terrible, awful, horrible cramps may have endometriosis and not even know it. PCOS, which y'all have heard about on YouTube, so I won't dwell on that. And then there are all the things that can go wrong that are a combination of the immune system and how hormones work. Migraines. More women have migraines than men. A lot of the autoimmune diseases like rheumatoid arthritis. And women tend to get that biggie, fibromyalgia. So what do all these have in common, and what is it that the medical system isn't getting right yet about women that you need to know about and I want to help you deal with? Overall, the biggie for women is pain. Pain. We have all of these things that cause us pain. Now, there are a couple of places to find research on what I'm about to tell you about pain. There's a Journal of Pain Research. We can put the link in the box below. The National Institutes of Health covered that. There was just a new newsletter that came out from Harvard Health that we could put a link to. But basically, there hasn't been any specific pharmacological research that has resulted in pain medications for women. Let me sit with that a moment. There are no specific pain meds for women. When I say that, I think, well, what are my pain meds? A heating pad, chocolate, tequila. Those are good for me, but those are not things that deal with pain that goes on and on, right? So let's talk about the medical system, pain, you and your doctor. What the medical profession is now admitting is that there are doctors who will gaslight you. Doctors gaslight women. Male doctors, women doctors, however they identify, they gaslight women. Part of it is the training. Part of it is we don't know enough about women's bodies. And part of it is what I just mentioned, which is there's no efficient pain medication, so they don't know quite what to do. I can also give you a link to an article that was just published by Northwell Health on this issue of gaslighting. Your doctor doesn't believe you. Now, this issue is a little triggering for me, and I'll tell you a story of one of my experiences with gaslighting before we move on. I have a genetic condition that I was born with. It causes pain. It causes pain in my limbs. When I was a little kid and I had recurrent infections and I had pain, my mother took me to the town pediatrician, who told her repeatedly that I did not have pain and that I was lying. That was one of the cornerstones of my childhood, that gaslighting, which was not to me but to my mom, and later doctors telling me the same thing. They were gaslighting me about I wasn't experiencing pain, I was perfectly fine. And it wasn't until I almost died that someone figured out what was wrong. If you believe that your doctor is gaslighting you, if you have pain that is not being addressed, it may be just a failure of the medical system. I'm not going to tell you that your doctor is a bad person. I'm not going to tell you to get a doctor who identifies a different way. What I'm going to tell you is there are a couple of things that make sense and that are recommended by the medical system and by doctors for what you should do if you are experiencing pain that is not being addressed. The first one is ask your doctor who they would recommend for a second opinion. It is a reasonable, fine, wonderful thing to do to get a second opinion. I have talked to a lot of women who say, I am worried that my doctor's feelings are going to be hurt if I ask for a second opinion. That is a red flag. If you think your doctor is going to break up with you because you're asking for a second opinion, then you need especially to ask for a second opinion, because that's not a doctor that you are confident is confident. You need a doctor who's comfortable and even encourages you to get a second opinion. The other thing you can do is ask for a referral to a specialist. Again, your doctor may resist that and may tell you that you don't need it. I am a big believer that you are your own expert. You know you. Let me say that again. You know you. If you have pain that is keeping you from doing what you want to do in your life, it is totally reasonable to ask for a referral to a specialist and another specialist and another specialist. You have the right to know what's going on. It may be that you get to a doctor who says to you, we don't really understand that yet. I've had that happen a few times. In my experience, those are the best doctors. The ones who can tell you the medical system hasn't figured that out yet are the ones who will work with you as a partner with the medical system as it evolves and figures out answers. What was true 2 years ago may not be true today. The system is starting to do more research on women. They're catching up to our needs. Your doctor can catch up too. Just keep doing your best to find out what's up with you if you don't think it's right. You may be embarrassed by asking for more help, but that's not as bad as being there and thinking, oh my gosh, I should have addressed this sooner. The point of all of this is the medical system has some catching up to do. There have been a lot of things that the medical system has gotten wrong about women. One of the recent notable ones is in the past 20 years, the medical system has figured out something as basic as our hearts are not the same as men. We don't have heart attacks the same way. If you want more information on your heart and differences between your heart and a man's heart, I would refer you to Dr. Suzanne Steinbaum and the American Heart Association that will give you details on how just one organ in our body is different than men's. We're going to find out a lot more about that, so keep on working on it. Here is the takeaway for you. The medical system wasn't built for you or me if you are a woman. I deserve better. You deserve better. And what that means is be a strong advocate for yourself. You're right. You are right about your body. Go for it.